Good afternoon, everyone. A warm welcome to our webinar on the topic Study MBBS in Malaysia. I'm Dr. Nimshad here from Eduzone, your host today. I also have Dr. Jihadul Islam, Associate Professor, Faculty of Medicine from University of Cyberjaya, and Mr. Shiva, International Students Department, University of Cyberjaya. So, today's topic is MBBS in Malaysia with scholarship, and we will be discussing about various opportunities which you can avail while studying at University of Cyberjaya. At the end of this webinar, we'll have a Q&A session where you can ask your doubts. So let us start with Dr. Jihadul Islam on the topic MBBS at University of Cyberjaya.
Colleagues who really thought I'm capable of doing this kind of bridging program between Malaysia and Eduzone in India, and it's really to Eduzone they have chosen a really right place, and through my presentation I'd like to explain why it will be worthy for the students who really wish to come and study in Malaysia. My PowerPoint can be seen?
Yes.
Okay. I'm representing University of Cyberjaya, Faculty of Medicine. And, I would like to present some of our significant university profile. So at the beginning, I would like to mention we are 15 years old university in Faculty of Medicine. And we have produced almost 1,200 medical doctors, and most of them now are secured their place as a houseman. In Malaysia, the houseman or internship is not similar like the system we have in India or in Bangladesh. Here, students have to submit their CV, and the hospital director and government, they choose, as they want from the student grades and from the institution they have graduated. So there are some preferences. I think so far there is no issue. Our student didn't get placed in the government medical, houseman posting here. And I would like to mention in Malaysia, houseman posting is a government job. So student who is invited by the Ministry of Health of Malaysia, they actually securing a government job. So that really signifying the status and the recognition level within the Malaysian government. Moreover, I would like to add, we've been rated as a 5-star university, and this star system or grading system is implemented by MHO or Ministry of Higher Education in Malaysia. And I think we are the only 3 or 4th private medical school who are able to secure this excellent ranking in terms of teaching, in terms of quality assurance and the research. Saying so, very recently we've been ranked as, because I believe the Southeast Asian students very concerned about the world ranking of the university. So not only we've been rated as the excellent institution within the Malaysia, but also globally. I would like to give some reference, like Western University of Australia is 300 something. In Canada, British Columbia, Dalhousie University is around somewhere 300 to 400. And majority of the first world country, if you within 600 to 700 or even within 1,000 of world ranking, it considered as quite very good. But still you are not taking rest, we are not really relaxing our effort. And I believe by next 2 years time, we'll be within top 300 ranked university in the world. Okay. So the Q-Star World Ranking, our emphasis on employability, facilities, inclusiveness, and teaching. So like preclinical students, junior students, for them, teaching is a very integral part. For that, they're paying for. So we're really taking care of all these student rights throughout our program. Okay, so as I did mention earlier, we have foundation graduate 1,700 and medical doctors is almost 1,200. We already produce. Why Indian students should consider University of Cyberjaya? Is not only top rank within the country, it is not only is world rank within top 600 university, but also we are able to secure recognition from Medical Council of India. And everybody know, if anybody graduated from foreign university, if it is not listed by the MCI, they even not eligible to sit for FMG exam. So foreign medical graduate exam, this is a prerequisite. Your institution should be enlisted, recognized by the Medical Council of India. Moreover, we also secure recognition from Bangladesh Medical and Dental Council, Maldives Medical and Dental Council. And I would like to tell the audience, at this moment, we have, if I'm not mistaken, almost total 30 to 40 international students in our MBBS program, which is leading by mostly Indian students, Bangladeshi students, and Maldives students. So any student they're coming here, they really going to feel they're in the home. There is not much cultural differences. A lot of Indian shops are there, and they're going to really feel homely. And in terms of teaching staff, lecturers also very diversified. We have mainland Indians lecturer, and I'm myself from Bangladeshi lecturers, and a few more other multi-national and multi-racial faculties are there. So what I try to mean, students really going to have a diversified teaching experience. So it's not going to be monotonous for them. Okay, I would like to introduce our leader. He is our Honorable Dean, and I would like to say some few words about him. He's the Major General Professor Dr. Zainuddin. He's a retired Major General from Armed Forces in Malaysia. He's a medical doctor, and he was the founder Dean of Armed Forces Medical School in Malaysia. I think every Indian citizen, they know doctors with Major General title. It really represents the leadership quality, the discipline capability, and overall monitoring capability of that person towards the institution. So he is very much keen. He worked very closely. He tend to know every single details about each student. He really follow the how caring we are towards our student. So, and his door is always accessible with the students. It may be local or international students. And he has a policy, any matter student concern, student can write him directly over the email, so that he is going to give his personal emphasis to sort out any issues is there. So saying so, Dean visits are the key factor for any of the schools and universities. And I'm not really hesitate to tell our audience, kindly you can Google our university faculty, and you'll be able to see the mixture of experienced and youth and scientists, so it's a really harmonious balance in our faculty, recruitment and also management. Okay, I think Edu, you will be get to know further details about the entry requirement, but I'm just going briefly. So we really require CGPA 3, but I'm pretty sure most of the Indian students having much higher grade than that. So that should not be a problem, but there is a one requirement by MMC, Malaysian Medical Council. Any student who want to enroll in MBBS program, they must have biology. Biology, chemistry, either physics or math. So we experience some O-level and A-level student, they might all doesn't have the math, physics or mathematics. So for us, either one will do. Okay. Okay, CGPA 3. So if the overall grading we require either 3B biology, chemistry, and math or physics, you should have either 1A, 1B, or 1C, either 2A or 1C. So what I try to notify here, if anybody having 2 Cs, they will be not considering for entrance in MBBS program. But I think in Indian perspective is very unlikely. In India, students are very focused, they are very good in study, and they are really all over the world. The greatest doctors are mostly from India. Okay, we also accept South Australian matriculation program and so on. Okay, syllabus curriculum is the heart of the program. So our MBBS program is really not the true MBBS program like we have in Sri Lanka, India, or in Bangladesh. Here we kind of adopt hybrid program. So what does it mean? I'll explain it slowly. So like in MBBS program, students, they're having some absolute theoretical knowledge. Once they complete 2 years of theoretical study, from year 3 and onward, they're going to clinical world. But very unfortunate, and from my 15 years of teaching experience, what I can say, with this traditional old curriculum syllabus, students, they read for 2 years basic science, and when they go clinical year, they forgot what they have to use. The reason this MBBS program not been integrated or need-based. So today you are reading about fever, but you are not really seeing different type of fever patient. Today you are reading about diarrhea, but you don't know what are the questions you should ask to a diarrhea patient to prescribe for the medication, because diarrhea can occur from very simple reason to until cancer. So once you don't have the practicum when you are learning the theoretical part, so it's not going to stay, it's not going to last in your mind for longer. So what we have adopted some integrated curriculum. So what does it mean, integrated curriculum? As I mentioned, integrated curriculum is not only lecture, it's not only the tutorial we have at present in the old MBBS curriculum, but it is incorporated with some of the clinical setting, some of the problem-based learning, some of the team-based approach of education. Okay, that is the grossly the description of the syllabus. But there is another very technical matter. Only the professionals people, they'll be knowing. Every syllabus, every curriculum, there are two kind of alignment. Horizontal, you just imagine like a train. So one train is arranged horizontally. So what you do, you pass from one compartment to another compartment. So what happening in old curriculum, when they pass two compartments, they forget what they have studied before. The carryover, or the remaining knowledge is getting shallower and shallower. So what have to do, students have to really study only like a blind. They really cannot see what they're studying and where they're going to apply it. So integrated MBBS curriculum, we follow some part of the North American MD curriculum, MD medicine. So what is that? They have some kind of vertical correlation as well. So what happened, semester 1, semester 2, semester 3, semester 4 is year 1 and year 2. So when students go for year 3 upwards, they always carry over the knowledge. How? By assignments, by doing some, the mannequins-based clinical study, and also problem-based learning. So that's why this MBBS curriculum, any student, they are interested to do USMLE, or they want to sit for AMC, Australian Medical Council entrance exam, or PLAB for British residency exam, it is much helpful for them. And I have many friends in India, and I really know the private institution, how much they charge for medical curriculum. So what happening, you are going to SRM or some other private institution, you are giving a bulk of money, few crores of money, but the curriculum is very, very old fashioned, which is not really up to date till today with the what is the Western world and North American world is doing. So any students coming from MBBS background, they found really hard to qualify themselves all those kinds of residency exam. However, if they incorporate with us, train with our this kind of program, it is much easier for them. They exactly know how the Western world they are doing the syllabus and how they really prepare for the exams. Okay, so integrated curriculum, I believe there are some new way of delivery, like problem-based learning. We spend almost every block 16 hours to really brainstorm about the problem, how it occurred, how to solve this problem, why some people having this kind of problems. So we having problem-based learning. In team-based learning, we give some assignment with the student, and student, they prepare within a group, and they do some kind of group presentation. So what happened, one student, they learn from each other, and also they develop leadership and some kind of presentation skill. I would like to emphasize on this area, e-learning platform. In Malaysia, I think most of the university, we adopted this e-learning policies a long ago. Not only Moodle, Microsoft Team, Open Athens, and we spend a lot of subscription fee for all this. So that from the very early age, student will be introduce themselves what is happening in Australian curriculum, because Moodle is a common platform where they can really roam around what is happening to the other part of the world. Clinical teaching, we are doing within 2 semesters. So why clinical teaching is very important? As I said, we are not only aligning our syllabus horizontally, but also vertically. So you are teaching me today, what are the reasons for headache? And I don't know how to react with a patient of headache. This knowledge going to be lost from my mind within few months. So what we are teaching, immediately we try to arrange some practicum for them. Year 1 and year 2 with the mannequins, we use some very high-tech, very close to human machineries so that they can practice there. So that is the beauty, or the secrets of Malaysian medical doctor success. There is a very open examples. Although Malaysia is a less populated country, the number of medical doctors is not much like Bangladesh and India, but they really well manage the corona situation. I think it is one of the lowest death incidence in the world, 0.3%. So what does it mean? Although being a small populated country, the manpower in medical profession is less, but they adopted technology very well. So that really make them to be competitive in the world platform. Okay, now I would like to give, if there is any doctor parents, if they're interested, so I would like to give some, breakdown presentation of our syllabus. So we also have a 5-year program, and we know in India and all Southeast Asian country, if MBBS is not 5 years program, they're not going to accredit it. So ours is a 5 years program. So year 1 until year 5. So in year 1, we have 2 semesters. In year 2, we have another 2. So altogether, total 10 semesters we have from year 1 to year 5. And we divide grossly our syllabus in 2 phases, basic medical sciences and clinical phases, junior and senior clinical phases. Okay, I would like to give an even further topics, breakdown what we really teach in year 1 and year 2. And this is very much helpful. And when I joined few of the expos with our marketing team, I came to know some of the doctor parents, they keen to know what are the topics you are teaching, how your syllabus look like. So this is how we start with the semester 1 behavioral science, some general anatomy, physiology, biochemistry. And you see here, even semester 1, we have clinical and professional development. So as I said earlier, we are not only giving the theoretical input, but also student has the opportunity to practice them with the disease and the patients. So same goes here. Even year 1, semester 1, they already exposed with the either dummy patient or with the real life patient. So semester 2 and semester 3 also go like that. And I would like to emphasize on another matter. Professional exams are mandatory to achieve MBBS program. So this part also very much similar with the Indian and other traditional MBBS curriculum. Why? Because they have to recall all these knowledges, courses they had, and they have to sit for the first professional exam. Once they complete this first professional exam, only then they are allowed to go for year 3. So once they move to year 3, now they are really properly trained and tuned to handle with the patient, real life patient. Now from year 3 onward, there is no mannequins or artificial patients. All are real life patients. And we post them in different hospital, and each of the posting doesn't contain more than 10 students. Malaysian regulatory body are very much strict on this regulatory matter. So they are very focused on student lecturer ratio and student and hospital bed ratio. So over year 3 and 4, they almost finishing all posting in one rotation. Year 5, there will be final professional exam after the second or third term rotation of the major clinical discipline, which is medicine, surgery, gynae, pediatrics, orthopedics. So once they're done, until year 5, they will be doing three terms rotation of all clinical phases. So they'll sit for professional exam, and whether local or international student, they will get a provisional Malaysian Medical Council certificate. Now, this is something extra I'm going to do for students from India. Example, any student, they're saying, okay, I studied in Malaysia and I want to study clinical subject, or I want to be a clinician in Malaysia. To me, there is no harm, because so many Yemenis, so many Lebanese, so many Arabs are working there. So nothing wrong if any Indian student, they want to work here. So there is a prerequisite how they can be a clinician in Malaysia. So once they pass this final professional exam, immediately MMC going to give them one provisional Malaysian Medical Council registration. After that, they have to do one houseman in a hospital which is recognized by MMC. So CyberJaya University has a lot of collaboration within India and also in Bangladesh. Those hospitals are already recognized by MMC. So student, after getting provisional certificates in final professional exam, if they have done their internship with any of the hospital is recognized by MMC, then they will be able to get complete MMC registration. With that complete MMC registration, they can study here for specialization, medicine, gynae surgery. So this is one of the factor may can influence parents to think about it, because if I'm not mistaken, postgrad study in India also very expensive. One of my friend done radiology MD in India. It cost them 2 crore Indian rupee, my friend. So in Malaysia, it's no matter of money. It's the matter of their qualification. It's the matter of they having the MMC provisional certificate. With that certificate, they can enroll with any kind of clinical discipline for MD or MS into the mainstream public universities of Malaysia. So that's how they can be even a specialist within this country. So normally I don't reveal this information with everybody, but I have many friends in India. So I'm telling all the truth and the secrets I know.